In the annals of medical history, few cases are as perplexing and unsettling as that of Gloria Ramirez, infamously dubbed the Toxic Lady. Her tragic demise on February 19, 1994, at Riverside General Hospital in California, not only claimed her life, but also mysteriously incapacitated several healthcare workers attending to her. Decades later, her case continues to baffle experts and intrigue the public. The night that started it all. Gloria Ramirez, a 31-year-old mother of two, was no stranger to pain. Battling late-stage cervical cancer, she was rushed to Riverside General Hospital on the night of February 19, 1994. Her condition was critical. Her blood pressure was dropping, her heart was racing, and she struggled to breathe. What the doctors and nurses didn't realize was that this would be no ordinary medical emergency. They were about to encounter a mystery that would shake the medical community and become one of the strangest incidents in modern healthcare. As the emergency room staff began treating her, they noticed a series of unusual phenomena. Her skin had a strange, oily sheen, and a fruity, garlic-like odor emanated from her mouth. While this was odd, the medical team pressed on, determined to save her life. But when a nurse drew blood from Gloria, the strangeness escalated to a whole new level. A hospital room turns into a scene of chaos. As Gloria's blood was drawn, one nurse noticed yellowish, crystalline particles floating in the sample. This wasn't just unusual, it was downright bizarre. Moments later, the nurse began feeling faint. Before anyone could react, she collapsed on the floor. Soon, other staff members in the room reported nausea, dizziness, and even shortness of breath. One by one, they fell victim to the mysterious ailment. The scene was nothing short of chaotic. Nurses and doctors staggered out of the room, some collapsing in the hallway. The hospital staff, trained to handle emergencies, suddenly found themselves as patients. Over the course of the night, 23 of the 37 ER staff members present reported symptoms, and 5 required hospitalization. For one nurse, Julie Korkinski, the effects were severe. She developed hepatitis, pancreatitis, and a vascular necrosis, a rare condition where bone tissue dies due to lack of blood supply. This was no ordinary case of workplace exposure. The initial theories: was it panic or poison? The incident left the medical community and investigators grasping for explanations. The first theory proposed was mass hysteria, also known as collective stress response. According to this hypothesis, the high-pressure environment of the emergency room, combined with the strange odors and circumstances, triggered psychological and physical symptoms among the staff. While this might explain some of the milder cases of dizziness or nausea, it fell short in explaining the severe conditions experienced by some workers, including organ damage. Another theory suggested a more tangible culprit: toxic exposure. But from where? Gloria's symptoms before her death didn't align with any known poisoning cases, and the hospital environment didn't immediately offer any clues. The staff's illnesses, ranging from fainting to long-term health issues, hinted at exposure to a powerful, unidentified toxin. Dimethyl sulfoxide, a plausible but chilling explanation. Months later, a team of researchers from the Lawrence Livermore National Laboratory proposed what remains the most widely accepted theory. They hypothesized that Gloria Ramirez had been using dimethyl sulfoxide, a solvent with a controversial history. Popular in the 1960s as a pain reliever, it was later discredited due to its side effects. However, dimethyl sulfoxide was still available in gel form, and some cancer patients turned to it for relief. According to this theory, Gloria may have applied dimethyl sulfoxide gel to her skin to manage her pain. Once in her bloodstream, the dimethyl sulfoxide likely metabolized into dimethyl sulfone, a compound that crystallizes at room temperature, explaining the particles observed in her blood. But here's where the real danger began. The defibrillation procedure used to restart her heart could have triggered another chemical reaction, transforming dimethyl sulfone into dimethyl sulfate, a highly toxic compound. Dimethyl sulfate is no ordinary toxin. It's a chemical weapon capable of causing severe respiratory damage, organ failure, and even death. If this chain reaction occurred, it would explain why so many hospital staff fell ill. In essence, Gloria's body had become a vessel for producing that deadly gas. The ripple effect on medical protocols. The incident sent shockwaves through the medical community. Hospitals across the country revisited their protocols for handling unknown chemical exposures. The case highlighted the importance of personal protective equipment and better training for healthcare workers in dealing with hazardous substances. Emergency rooms also began reevaluating how they approached unknown or complex cases. Gloria's case served as a reminder that even routine procedures could lead to unexpected dangers. Media frenzy, the birth of the Toxic Lady legend. When the story broke, the media pounced on it with sensational fervor. Gloria Ramirez became known as the Toxic Lady, a nickname that turned her into a macabre curiosity. Tabloids speculated wildly, with theories ranging from government cover-ups to extraterrestrial involvement. One article even suggested that her death was a failed military experiment. While the media attention helped bring awareness to the case, it also trivialized the tragedy. Gloria's family struggled to cope with the public spectacle, feeling that her humanity was being lost in the frenzy. Lingering mysteries and scientific debate. Despite the dimethyl sulfoxide hypothesis, significant questions remain unanswered. Could the chemical reactions described in the theory have realistically produced enough dimethyl sulfate to affect 23 individuals so severely? Some scientists argue that the concentrations required to cause such widespread symptoms would need to be extraordinarily high levels, unlikely to occur under the circumstances described. Moreover, the conditions necessary to trigger these reactions, such as the precise temperature and chemical environment, have been called into question, leaving room for skepticism. Others suggest that an unidentified compound or a complex combination of factors might have been at play. Could Gloria's medications, her cancer, or even environmental contaminants in the hospital have interacted in unexpected ways? With limited samples for testing and the unfortunate loss of critical evidence, definitive answers have remained elusive. This enduring mystery underscores the gaps in our understanding of how certain chemicals behave in the human body under extreme conditions. Gloria's case continues to haunt both the medical and scientific communities, a chilling reminder of the unpredictability of human biology and chemistry. The legacy of Gloria Ramirez. Gloria Ramirez's story is more than just a bizarre medical mystery. It's a testament to the complexity of science and the unpredictability of life. Her case forced hospitals worldwide to rethink safety protocols, improving the way medical staff handle unknown substances and protecting healthcare workers from unforeseen dangers. It also sparked important discussions about the ethical responsibilities of the media, as sensational headlines overshadowed the deeper, human aspects of her tragedy. At its heart, her story is also a profoundly human one. Gloria was a mother, a daughter, and a woman fighting cancer with resilience and courage, navigating a disease that left her vulnerable yet determined to live as fully as she could. Her case serves as a reminder not only of the unresolved mysteries of medicine, but also of the importance of treating every patient with dignity and compassion. Beyond the science and controversy, her story challenges us to honor the person behind the mystery, whose life was much more than the events of that tragic night. And that, my friends, is the baffling tale of Gloria Ramirez, the Toxic Lady whose story still puzzles scientists and fuels late-night debates. If you love diving into mysteries like this, smash that like button, hit subscribe, and join us as we unravel more mind-blowing stories. Who knows? The next mystery might just leave you as shook as this one.